Thank you for joining us today as we continue our video series on COVID-19 prevention on the farm. Today, we are going to talk about symptom screening and how it can be used during the COVID-19 pandemic with our guests, Dr. Fred Gerr, a physician who specializes in internal medicine and occupational medicine, and Dr. Renee Anthony, a professor in the University of Iowa's College of Public Health. Thank you both for joining us today. To get started, Dr. Gerr, could you just explain what screening means when we talk about symptom screening or symptom surveillance?
Simply put, screening is a way of identifying an illness or an ailment in a large group of people.
So in terms of COVID-19, how does screening work and how well does it work?
So it's a great question. Screening has been proposed as a way as one of the tools for preventing the spread of COVID-19 in workplaces and in communities. And screening is done often by asking people whether or not they're experiencing or feeling any of the symptoms that occur with COVID. And symptoms is just a medical word for either reporting that you have a cough or that you have a fever or that your muscles ache. So that's all we mean by symptoms. And screening is done so that we can identify people who are likely to have COVID and also identify people who are not likely to have COVID. The goal being, of course, that we tell people who are likely to have COVID to stay home, and we tell people who are not likely to have COVID that it's okay for them to go do their jobs or go about their business in society. One problem with screening for COVID in particular is that using symptoms, that is that symptom screening for COVID doesn't work very well. And that's unfortunate because screening is pretty easy to do. It's cheap. It can be done almost anywhere. But the problem, as I just said, is that it's not very effective. What I mean by not very effective is that a lot of people with COVID will pass right through a screening activity. About 4 out of 10 people with COVID have no symptoms at all and will never be identified in a symptom survey or a symptom screening effort. To make matters worse, pretty large proportion of people who don't have COVID may have one or more of the symptoms that are found among people with COVID and will therefore be identified on a screening tool and won't be allowed into an area or an activity where they would otherwise be able to enter or perform. So let me start by explaining this. The Centers for Disease Control, CDC, has put together a list of some 11 symptoms that occur more often among people with COVID than among people without COVID. I reviewed this list and also went to the medical literature, and I ended up observing that because headache is so common among people without COVID, using headache as a way of separating people who have COVID from people who don't have COVID is not particularly effective. That's why there's a line through it on this slide. The same thing is true for sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. These symptoms are especially poor or weak at separating out people with COVID from people without COVID. On the left-hand slide, the 6 bullets are symptoms that do a better, but not a great job of separating out people who have COVID from people who don't have COVID. So as you can see, new loss of taste or smell, and we'll get back to that one in a minute, because that in a sense is a special symptom. Fever or chills, cough, shortness of breath, fatigue, muscle or body aches. And it's important to remember here that some of these are very common. For example, fatigue. A lot of people experience fatigue for a lot of reasons. And by itself, fatigue is not a great way of separating out people who have COVID from people who don't. Same with muscle or body aches. People get muscle or body aches for all kinds of reasons. Of course, COVID, other viral illnesses like the flu or even the common cold, but then even just excessive physical activity can give people soreness for a day or two. So that's the problem with many of these symptoms, is that they occur among people who don't have COVID. New loss of taste or smell, in particular, is very highly linked to COVID-19. New loss of taste or smell is very, very uncommon among people who don't have COVID. So whenever a person reports new loss of taste or smell, that's a red flag. And that individual really needs to contact their own healthcare provider or their county health department. It's important to realize, though, there are still people with COVID who don't have any loss of taste or smell, and to rely on that one symptom alone is going to let lots of people who do have COVID right through the screening process.
You talked about how anyone with a fever, regardless of whether it's COVID or not, shouldn't be in a workplace, because that means they're likely infected with something and could spread that to others. So I think that brings up a question that we've seen a lot lately, is do employers need to be taking temperatures of employees before coming to work?
Some employers do, and some employers don't. Employers can also ask their employees to take their temperature at home, and if they have a fever, to stay at home and not report to work. Doing that has some public health benefit, because that way people with fever aren't using, say, public transportation or carpooling or however else they transport themselves to their workplace. But it's important to recognize that this is also imperfect. People with COVID don't necessarily have a fever above 100 degrees Fahrenheit, which is the common cutoff point for deciding that somebody has enough of a fever to potentially have an infection with COVID or anything else. So as a result, screening for fever is also a blunt tool. Some people with COVID will get through it. Some people without COVID will get stopped by it. But from a larger public health standpoint, it's probably best if people with fever stay at home no matter what causes that fever, COVID or anything else, until they either get better and don't have fever. And I mean, by the way, don't have fever without having to take either Advil, ibuprofen that is, or acetaminophen, Tylenol, in order to control that fever.
Dr. Anthony, I think this brings up another point. So if employers are taking temperatures at work, what do they need to know about that?
Right. So when we're taking temperatures or any other health measurement of an employee, we as an employer do have to maintain that information as part of our medical records. So if we are screening everybody that's coming into the office or into a work location, we've got to have a system in order to document who we took temperatures of, and if they were high, we could write those down, and everybody that wasn't high, we would note that they weren't high on that date. But those records need to be kept as part of the employer's data records. It's usually kept apart from human resource files, away from those decisions of payroll, but we are required to maintain those per our federal regulations. And the problem that's scaring some folks is that those are to be kept for somebody's duration of employment plus 30 years. So it's good to have a system set up to do that so that you can maintain those records and remember not to throw those out over time. But it's a big commitment if you do start taking temperatures at the workplace.
Dr. Anthony, do you have any other final thoughts or any other things that you would like to share on this topic?
Yeah, I think it's important to have an idea of if you're doing screening or not doing screening, but you've got workers coming into your facility, to really think through and have a plan for what you're going to do if somebody starts to develop symptoms while they're at work. So who do you need to contact in order to get somebody maybe taken back home? How do you get them out of the workflow? Is there a special area you can take them to so decontamination becomes easy? And also, who are you going to call at public health to let them know that you may have somebody that's going to test positive, and how do we do that contact tracing at our workforce? So pre-planning on what to do is really going to save a lot of time when you start seeing, if you see somebody at work develop those symptoms.
Absolutely. Thank you. And then Dr. Gerr, are there any other final thoughts that you have on this topic?
Plenty of people who have COVID, in fact, 4 out of every 10 people with COVID feel fine. And as a result, those people are going to slip right through any symptom screen and have the potential to infect others if all of the approaches and methods that we use to prevent spread are not being employed properly.
Thank you to both our guests for helping us understand some of the issues surrounding COVID symptom screening at work. If you have any questions, please contact us at cph-Great Plains Center at uiowa.edu and check out our website for additional resources.